The days might be getting longer, and yes, we have had an unusually warm winter, but for some, they're still struggling with the winter blues. This morning, we are joined by Liesen, Counseling and Behavioral Support Manager at Easterseals MORC, with some tips on how to get out of that winter blues slump.
Thank you for having me. Good morning.
Of course. So for people that may not know, how do you define winter blues?
So winter blues is, I think we all get winter blues to some degree. You know, we're inside, it's cold, nobody wants to get out and scrape their windows, and we're not connecting with people. And so over time, you know, we can start to experience cabin fever, and that cabin fever can even lead into clinical depression known as seasonal affective disorder.
Is there a difference between seasonal affective disorder and winter blues?
Absolutely. So the winter blues is something that, you know, is kind of a discomfort, and we all are able to adjust to it. But for some people, that adjustment is really hard. You know, when a person has seasonal affective disorder, they have a tendency to produce less serotonin. You know, we have longer nights and less days, so we're getting less sunshine. And that lack of serotonin can change the way that we feel, the way that we eat, the way that we concentrate. So a person with seasonal affective disorder might find themselves feeling more fatigued, crabby, off their game. Their sleep pattern starts to change, their eating habits start to change. They might start putting on some weight because when we don't get serotonin, we tend to crave carbs. And then overall, it just kind of makes you feel really, you know, like you don't feel really good about yourself. And it can actually lead to feelings of, thoughts of suicide and death. So it can be pretty significant.
Yeah, it sounds like it can be pretty serious. So how do we combat this then?
You know, it's a great question, and it's actually an easy answer. You know, little things that you can do to just kind of bring yourself out of that funk is eating healthy. That's like a number one. Eat healthy, try to get a good night's sleep, don't have a lot of electronics on when you're trying to sleep. Very first thing in the morning, try to expose yourself to some sunlight, maybe sit by a window while you're drinking your coffee. Connecting with others is super, super important. And exercise. And one way that I can connect with others and exercise at the same time is I'll throw on a YouTube video that's maybe 5 minutes long and get some exercise in. And if I do that like maybe 6 times a day, that's 30 minutes of exercise. And that exercise is producing endorphins and helping you kind of like feel good about yourself again. It kind of brings you up out of that funk.
So Easterseals MORC has recently developed the Winter Seal of Approval. What exactly is that?
The Winter Seal of Approval is mostly education, helping people to understand that there are these little things you can do, incorporate into your day that don't cost a lot of money and are accessible, such as exercising, eating healthy, getting really good sleep. You know, just tips about, you know, it's important to see your physician, and maybe you're not feeling this way because you've got some other things going on, like hypoglycemia or hypothyroidism, or a viral infection can cause these kind of symptoms. So it's a good tool to go to just to remind yourself of those things that are out there that can help you. Easterseals MORC provides counseling, a combination of counseling, specifically cognitive behavioral therapy, antidepressants can help, and also light therapy, sitting by a light box for 20 minutes a day.
When should you know, I guess, as an individual, that you've reached the point where you need therapy, or maybe you need some sort of medication? When does it become more than just eating healthy and exercise, and you need that extra step?
Yeah. When you start to feel like your daily functioning, you're really struggling just to get through your day. If you used to love doing a particular activity and you find yourself having no energy to do that, or not even wanting to do that, things are starting to pile up because you're feeling so low. You're not getting to, you know, your normal activities. You're isolating yourself a lot. That's when you start to feel like everything is a chore, everything is a challenge. That's when you really need to pick up the phone and call somebody.
Well, Liesen with Easterseals MORC, thank you so much for being here with us this morning and just giving us just a little bit of a glimpse of what we can do to kind of get out of that winter funk.
Absolutely. Thank you for having me.
Of course.